Hi, my name is Tiffany Campbell. I am a vet tech at Live Oak Veterinary Clinic in Moncks Corner, and this semester I am taking anesthesia and surgical assisting techniques. So today I'm going to go over a few things with you. We're going to start with the paperwork side of anesthesia, working with surgery, and patient care. So the first thing that we have here is our admission form and release consent forms. We use the same paperwork because it has all of our information on there. There are consent lines, and then there is admission information. So the patient that we have here today is Zed. He is a 7.5-year-old neutered male hound mix. He's actually my dog. And the procedure that we're going to talk about is a mass removal. Basically what we like to do is come up with the estimate for what we would like to do for the patient that day, and then we'll go over it with each client line by line so they can see exactly what they're paying for. For example, when going over this estimate, we would show that there is a hospitalization fee, which is just covering the time that he's going to be here, the amount of care he's going to get. He's going to be taken out for walks. He's going to have a nurse assigned to him that keeps up with him throughout the day. We have sedation and anesthesia monitoring fee. That's just the cost of the drugs we use to sedate him, as well as the cost of having that surgical nurse take care of him while he is under anesthesia, making sure that he is taken care of appropriately and appropriately monitored. We have the cost of the actual procedure, which is mass removal. And then at the bottom, we've got a couple of inventory items. One of them is isoflurane. That is the inhalant anesthetic that we use to maintain him. The other two are cephalexin and Metacam. Those are medications that we would want to send home with him. One is an antibiotic and one is a pain reliever. We go over prescription information at discharge. We just like to go over it with them when discussing the estimate, as well as the consent for the procedures. What we have on our consent forms is, of course, your consent for admission, stating that we're just going to be keeping your dog for the day. We also have unexpected complications for anesthesia. We have 3 options for our clients, one of which is that in the event that unexpected complications arise, that we do nothing until we reach them. Option number 2 is that if unexpected complications arise, we perform all necessary life-saving procedures immediately, but delay any further procedures until we reach the owner. The third is that the doctor may exercise his or her professional judgment and proceed accordingly until we reach the owner. Of course, in the event of any unexpected complications, the first thing we're doing is having somebody get on the phone with that owner, immediately start trying to reach them. We then have information about the owner, so best numbers to reach them that day, throughout the hours that the procedures are going to be going on, as well as the hours that the patient will be here in the hospital, and then the consent lines. The next super important piece of paperwork is our medical records. So our medical records are fully digital. They are locked anytime somebody's not at a station, and you have to log in with your individual PIN. Now here we have Zed's record. We see his signalman up here, as well as his reminders. We see the last time things were done, as well as a chart that tracks his weight trends. When you scroll down, you see the different medications that have been dispensed. The entire medical history is here. The soap, any anesthesia forms, all that good stuff is right down here in the medical records. Any previous medical records can also be scanned into this program so that we can keep all of the paperwork in one centralized area, online and out of the way. Something that is important to always do when you have a ton of patients, or even 2 patients, or even 1 patient, is to make sure that your cage is labeled. Any area where any patient is in should be labeled. We use cage cards that has the owner's information, address and phone number, as well as basic information, his age, the fact that he is a neutered male. We also like to add onto our cage cards what procedure they're here for, as well as any items that they were checked in with. So we make sure they leave with exactly what they came with, and also that we're performing the correct procedure on the correct patient. Another important piece of paperwork is lab forms. So what I have here is a lab requisition form. Whenever we are sending off samples to other labs, we make sure that they have this form with them so that the lab knows exactly what we're sending them, exactly why we're sending it to them, and exactly who it belongs to. It includes the doctor on the case, owner and client information, a signalment on the patient so they know exactly what kind of values we're looking at, whether they need to be testing for canine or feline, and then the test and the test code. We also keep a lab book in-house so that we know exactly what was sent to the lab and what results we've gotten back, so we know when we need to contact owners about their different results. Something that's extremely important in surgery is the anesthesia log. We keep a lot of information on here, as you can see. First thing to do is make sure you have your patient and client information up here, weight and kgs, so that you can know for quick dosing in case you have to do any quick math. That's one step taken out of it. We keep track of things including the medication, so pre-meds, induction meds, and what type of drugs we're using to maintain them, as well as their vital signs, anesthesia, surgery, and intubation, extubation, start-stop times. We also keep track of them during recovery to make sure that all of your vitals are staying within normal limits. We also make sure on a second place that we are logging any type of emergency drugs and any type of additional comments that may not fit into these. So anything that you notice while the patient is under anesthesia, you're going to want to make a note of. Everything should be noted. The final piece of paper I'm going to go over with you is a prescription label. These contain a ton of information. It shows exactly what we're dispensing and how to give it. Now, when we go over discharge instructions, we have printouts available, but we also like to go over them verbally with the client. So for instance, after a mass removal, depending on where it was, we would want to make sure that the client is keeping the patient kind of quiet over the next few days. So make sure he's not running around, jumping, doing anything that could potentially damage the repair that we've done from the mass removal. We want to make sure that we're protecting any sutures or staples that are in, so make sure the dog is not out in the rain, not getting in the mud, make sure we're protecting that incision appropriately, no rough housing. Want to monitor for any signs of swelling, any drainage, anything like that. We want them to give us a call and let us know so we can kind of help guide them and let them know when they need to come in. After surgery, it's also important to go over each individual prescription with them. For instance, Medicam is an NSAID, and if the dog had a prescription of steroids at home for whatever condition, you wouldn't want to give these at the same time because there can be a conflict between NSAIDs and steroids. You also want to make sure that the owners are being careful. For instance, if they have a sensitivity to sulfa, if we prescribed SMZs, they want to make sure that they're wearing gloves when handling those medications. All of these are things to think about whenever you're discharging your patient and overall in any type of care that you're giving them. Done. All right, today I'm going to demonstrate a few different holds, different restraints for drawing blood. The first is going to be for a cephalic blood draw. You want to use this arm and kind of cradle their head in the crook of your arm while pulling them close to you. This leg will be extended out and you'll roll the vein. You can use your elbow to pull the patient in close to you so you retain a nice, snug, firm hold on them. Another type of hold we could use, hey mama, is if we were going to draw from a jugular vein. We're going to just use our pinky to hold our collar, tilt the head up, once again using your elbow to kind of draw the patient close to you, and extend their head up, pointing their nose up. Some people will ask you to drop their head a little bit. turn it to the side so they can have better visualization of the vein. And then the third type of hold that we would want to do is for drawing blood from a lateral saphenous vein. For that, once again, we're going to want to cradle our head in our arm. We're going to go back here and hold off the vein using our forearm to pull the patient's body towards you, maintaining good contact and holding off, keeping good pressure. And those are your basic holds for drawing blood from a canine patient. I'm going to demonstrate the appropriate way to move a patient in and out of a kennel. I've got a kitty cat here. His name is Blue. And I'm just going to show you how to move him. So he's chilling in the back corner of the kennel. We want to be as nice and calm and quiet as possible. We're just going to go ahead and open up the door. I'll reach one hand in. I'll only crack it a little bit till I get one hand in, so I can make sure that I'm getting to him, restraining him. Then I'm just going to reach in and pick him up. Hey, Baba. And I'll kind of have him in a football hold. So have his legs, have a hand here so that I can scruff him if need be. Then we would just go ahead and let our door close, and our doors do close automatically. So in order to put him back in, it would be the same thing in reverse. We would want to just go ahead and gently set him in, facing the back of the kennel. Keep a hand on him until we have our door mostly closed. Like, you just slide out. You're going to want to make sure that your kennel does stay locked and that it is fully secure whenever you get done putting a patient into it. Alright, we're going to go ahead and place a muzzle onto Charlie here. You want to make sure you have the appropriate size first off. You're going to come over the head, holding it from both sides with the skinny side up. Put it over their nose, bring the straps behind. You want them a little bit loose when you're putting it on so that you can tighten it to the appropriate size after it's already been placed on them. Alright, we have our patient that's waking up from anesthesia. We're going to go ahead and put an e-collar on him. Hey, Papa. So I've got an e-collar here. We pre-fitted it before surgery. There's a wide variety of different types. Basically, the principle is all the same. For this one, we've got it, like I said, pre-fitted. We're just going to go ahead and slide it over his head. I've got some gauze string here. I'm going to pull tight and tie it in a bow. Hey. And he'll be all good to go. When you're selecting an e-collar, you want to make sure you select one that's long enough that they can't get their head around it to get to whatever we're trying to keep them off of. So from their surgery site or a wound, anything like that. Alright, we're going to go ahead and do a TPR on Zed here. That's just an abbreviation for getting temperature, pulse, and respiration, your basic vital signs. So I'm going to start with our respirations. That's just counting his number of breaths. I'm going to put my timer for 15 seconds here, and we're just going to count the number of respirations he's got. Alright, so that's 15 seconds. His respirations are sitting at about 35 right now. Next, I'm going to go ahead and give his heart a listen so we can get his heart rate. I also want to listen to his lungs and make sure that everything sounds good, no cracks, wheezes. his heart rate is at about 90 right now. And the next thing we want to do is go ahead and take his temperature. Now when I listened to his lungs, everything sounded great. No cracks, no wheezes, nothing like that. So I'm going to put a little bit of lube onto our thermometer and insert it in the rectum. Taking vitals is an important part of both your physical exam as well as your pre-op exam. You're going to want to take their vitals multiple times, especially the morning of a procedure, just to ensure that everything is good and clear with them. Alrighty. Looks like our temperature is at 101.6. So that's within normal limits. We would assign him an ASA score of 1. He is a normal, healthy patient. Alright, we're going to do a TPR and a basic exam on Hope here. Obviously, as we can see upon gross examination, we've got some scabs going on here. We'll probably clip her up so we can get a good sample to check that out. But we're going to go ahead and get her TPR. We're going to listen to her heart and lungs. I'm going to start by listening. Let's see. Hey, Mama. You want to listen in the same areas that you listen to for a canine patient? All the way around. You want to listen for any arrhythmias, any abnormal sounds, whooshing in between beats, skipping beats, things like that. So I'm going to go ahead and just look here. We'll get a stopwatch started. Alright, everything sounds good with her heart. I want to listen to her lungs. I want to start by listening to her trachea and listen in all quadrants of the lungs. Hey, Mama. I'm going to lift up your head just a little bit so I can listen here. And then I'm going to listen all around on both sides. You want to listen for crackles and wheezes. Any type of stutter. Any abnormalities that you know you would want to immediately bring up to your veterinarian. Her lungs sound great. So we're going to go ahead and take a respiration rate. Hey, Mama. And that's just counting the number of breaths per minute. All right. Now I also want to take her temperature. So I'm going to put a small amount of lube onto my thermometer. Hey, little lady. It's okay. You want to make sure you have an assistant to help you with this. Most animals are very resistant to having their temperature taken. Your calculation for figuring out your heart rate and respiratory rate is as previously explained you count for an allotted period of time and multiply it based on what your allotted amount of time was. So Hope's heart rate, I counted for a period of 10 seconds. My temperature is still going up. And because of that, I had multiplied my number by 10. Our heart rate for her is about 120. Our respiratory rate, I counted, here we go. Our temperature is 100.3. That's a normal temperature for a healthy cat. Our respiratory rate was about 32 for her. So she's a little bit stressed out, but overall everything's good to go. I would assign her an ASA score of 2 just because we would want to double check her skin. Overall, as long as her blood work and everything came back normal, then we would be fine to proceed with surgery if the surgeon was comfortable with it. As you can see, our patient needed to be repositioned after our intro. She wasn't too happy. But now I've got the volume I need. I'm going to put my finger over the site of insertion. I will pull back, and as you can see, we got a nice sample there to do a T4 free T4 check. So I'll recap my needle. Mildred will hold off for me, and we'll be good to go. All right, we're going to go ahead and do a blood draw from a jugular vein on Nash here. What we like to do is, number one, make sure we have all our supplies together. So I've got my blood tubes, I've got my serum separator and EDTA tube. I have my syringe and needle here, and I've got my prep alcohol swab. We're gonna go, what I like to do is first hold off on the vein so I can try and isolate it prior to prepping the area. And then I'm gonna go ahead and make sure your bevel is pointed up towards you. And then we're going to go ahead, and we've got some blood here. Just enough for demonstration purposes. We've got our blood. And we'll go ahead, we can actually run an in-house PCV with this, so we'll go ahead and start getting some values on this guy. Alright, we're going to go ahead and draw blood from a saphenous vein here on Guinness. I've got the vein isolated. I'm going to go ahead and wipe it with an alcohol prep and cap my needle. Alright, I'm going to go ahead and withdraw. And as you can see, we've got our sample. The end! Some monitoring. I've got Mildred holding off the vein. I'm going to go ahead and isolate it. Now all we need is one drop for an in-house FELV FIV test. So I want to isolate my vein first, then I'm going to prep the area with an alcohol swab. I'm going to uncap my needle, bevel facing up. Like I said, we only need a tiny drop. Alright, there we go. We've got our tiny little drop. I'll hold it. I will. There we go. Good girl, Hopi. It's okay. Alright. And as you can see, we've got our sample. We're all good to go. Alright, we're going to go ahead and draw blood from our feline patient here. I'm going to uncap my needle. Bevel up. Alrighty, Mildred, if you want to hold that off, we're just gathering a sample for thyroid, so that should be sufficient. I'm I'm going to briefly go over the minimum database you would like for a preoperative patient. The first value is your ALT, or alanine aminotransferase, your BUN, which is your blood urea nitrogen, your PCV, packed cell volume, TP, total protein, and your BG, your blood glucose level. Basically, these give us a very brief overall look at the body systems of a patient. Make sure that we don't have anything going on with our kidney or liver function outstanding, and also to make sure that our blood glucose is high enough and that our blood cells are at an appropriate ratio to withstand a surgical procedure. Now, if, for example, you had a patient that on their physical exam exhibited, for example, a heart murmur, you may want to go ahead and proceed with a full cardiac workup, including like troponin levels and ECG. You may want to do multiple blood pressure checks throughout the day. All of these can be extremely helpful in evaluating a heart murmur and potentially detecting an underlying cardiac issue such as cardiac disease, something like that. In our practice, we also like to have a PT-PTT prior to any surgical procedure, just so we can check up those clotting times, make sure everything is in order there, and ideally we would like a full super chem, just so we can see a good overall view of a lot of things with our kidney, liver values, and organ function. When determining anesthetic protocols, of course, as a technician, we don't determine those. However, we do work closely with the veterinarians in determining what will be the best option for our patient. Step one would be to go over your preoperative exam and your databases for that day. Make sure all of your lab work is within normal limits. The patient I'll be referring to today was a 6-year-old male husky. All of his lab work came back within normal limits. His physical exam was completely normal, no signs of arrhythmia, no signs of problems with the lungs. So for him, we decided to go ahead and administer an NSAID. That was an injection of meloxicam. We dosed that at 0.2 mg per kg. He was 55 pounds. So we went ahead and gave that injection first thing as soon as we were done with our lab work and our exam. We also gave him a small dose of butorphanol. Now, this was because he was extremely stressed out. We also like to do things such as place our IV catheters as soon as our patients are cleared for surgery, and sometimes giving them an IM injection of a light pre-med will help kind of calm them down a little bit and kind of make everything a little more easy on them. For our induction, we administered propofol, 6 mils to effect, and then he was maintained on isoflurane. We use propofol because it does have a wide range of safety, and since we had no problems based on our husky's lab work and exam, we felt that it was safe to proceed with that drug. Alright, I'm going to demonstrate how to appropriately make an entry in a controlled drug log. Now, we're going to go ahead and use a fake drug log here, just for the sake of demonstration, a mock drug log, if you will. Now, your drug log has a few very important parts. You've got your butorphanol, which tells you what drug it is, what schedule the drug is, the form of the drug, the strength, so 10 mg per mil, and the size of the bottle, which is 10 mils. So when you start off, of course, when you open a bottle, you have your first entry. It's got the date, the note that the bottle was opened, what bottle number, how much was in that bottle, and then an authorized signature, usually 2, whenever a bottle is open. So we'll go ahead, we'll put a date in there. This will be for the day after it was open, so 3/3/19. Our patient's name, our mock patient, will be Fluffy. We put the name and our address of client. So John Smith at 123 Happy Lane, Monk's Corner, South Carolina. The species of our patient is important to note. So we'll say Fluffy is a dog, so canine. Once again, we write down which bottle we pulled from. So say bottle number 62 for the sake of our example. And how much was used. So we're going to go ahead and say we withdrew, say 0.5 mils from our bottle. At which point we'll go ahead, we'll get a calculator out, and then we'll leave us with 9.5 mils left on hand. So at that point you want to go ahead and sign, whether you sign your name or initial. So I'll sign my name. And then if this was a real patient, I would then go to the veterinarian and have them sign an initial as well. So as you can see, I've got my log all filled out here. And that would be the steps for filling out a basic controlled substance log. All right, I'm gonna go over the basic parts and functions of an anesthesia machine. We're gonna start down here at the bottom. I've got my oxygen tank, which of course stores our oxygen or O2, and it's got a valve here that tells us exactly how full it is, how much oxygen we've got left remaining in that tank. In order to get oxygen to the patient, we've got our flow meter here. In order to turn the O2 on, we just open that up. As you can see, it's got marks in there, so we can see exactly what volume of oxygen that we're delivering to that patient. We have our reservoir bag. A reservoir bag serves a lot of different purposes. Number one, of course, it serves as a reservoir for anesthetic gases. It also allows the anesthesiologist to monitor visually the breaths that the patient is taking. It also is used in conjunction with our pop-off valve to give our patients, we can give them a breath if needed. So I'm going to jump right up here to the pop-off valve. A pop-off valve can be left all the way open, it can be left all the way closed, it can be partially open, partially closed. It just depends on what that individual patient's needs are. A pop-off valve allows excess anesthetic gases to escape the system to our scavenging tube. For example, if it was left all the way closed, all of the gases would stay within the machine, which would of course build up your pressure until you took a breath or released it using the pressure relief valve. There's a button right here. It's kind of difficult to see, but it's right here. What we've also got here is our soda-sorb canister. It houses the granules that filter out CO2 from any of the gases that are cycling through our system. Now these granules have to be changed out relatively frequently, every 8 or so hours. You can always do a test of them after any surgical procedure though, just to ensure that they are still quality. They'll change color, that's a good indicator that they need to be changed, or they'll become much more brittle when it's time for them to be changed. Now, we've got, of course, our breathing tubes here. We've got our inlet and then our outlet and our adapter piece that will connect directly to our ET tube. Now over here, we have an extremely important piece. This is our vaporizer. This is what converts our liquid inhaling anesthesia. So we use isoflurane in our practice. It converts the liquid isoflurane into gas. It is what essentially allows our patients to stay under. We have a dial up here. I'm not going to turn it on, but we have a dial up here. It does have different markings on it that shows us exactly how much we are, exactly how much inhalant anesthesia that we are using, exactly how much ISO we have up, so that you can kind of go up and down adjusting to depending once again on your individual patient's needs. Now to top it all off, of course, we have our exhaust tube, basically. Scavenging tube is what we call it. And that is what allows all of the used up trash gas, basically, to leave the system, to exit the animal, so that it's no longer circulating within our system here. Now, that's a very brief overall view. I also did want to mention up here our pressure valve. I included it in my description of our pressure test on an anesthesia machine, so we went over that in the other video. I just wanted to make sure that I mentioned it here. It does measure the overall pressure that is within our anesthesia system. So that's just an overall very superficial look at the different parts of an anesthesia machine. All right, I'm going to perform a pressure test on our anesthesia machine here. I've got it all set up. I've got all my tubes connected, my scavenging system connected, and I have my 1 liter bag attached. What you want to do when you're setting up for a pressure test is close off your pop-off valve. You want to locate your O2 flush and occlude the end of your tubing here. You can do that with your thumb or with the palm of your hand. And we want to go ahead and fill it until our manometer reads about 25 centimeters. You want to let that sit for about 5 to 10 seconds just to make sure that we're not losing any oxygen anywhere, so we can determine whether or not our system has any leaks. All right, so the pressure reading hasn't gone down any at all. So at this point, I want to go ahead and open up my pop-off valve so I can make sure that it is exiting the system through the proper channels, through the scavenging system. So I'm going to go ahead and open that up. We see that the dial went back to 0. Everything exited out the appropriate way. I kept this occluded the entire time. And so now our pop-off valve is open, our pressure test was a success, and we are ready to start our procedure. All right, I'm briefly going to go over endotracheal tubes, the selection of them, and examining them prior to use. So whenever you're selecting your ET tube for your patient, there are a wide variety of factors that can influence your decision. One of the main things we take into consideration is conformation and weight. So you want to make sure that you are selecting a tube that is large enough for the size of animal that you're using, or in some cases small enough for the animal that you're using, while still providing an effective seal, making sure that it's doing everything that we needed to do, fulfill its job. Parts of an ET tube. You've got your adapter piece here that allows the ET tube to be connected to your anesthesia machine. You've got your inflator here. You've got your cuff down here. And of course, we've got a beveled edge on this end, which can help to aid in passing our ET tube. Also, our ET tube has graduated marks here in centimeters, so we can see exactly how far down into our patient our ET tube has been advanced, and we've got a size here clearly delineated. So whenever you're choosing your ET tube, once you've got a weight, you've got the confirmation of your patient, and you have an idea of what size tube you would like to use, you're always going to want to make sure you grab 2 extras. So you want to grab the size that you think you may need, a size up, and then a size down, so that whenever you do actually go to place your ET tube, if you find out that it is perhaps smaller than what you would like, you already have a step up, and vice versa. If it's too large, you have a step down ready and waiting on you, so that you're not wasting time trying to go back and forth and selecting these things. Before you place your ET tube, you want to do a good overall examination of it. Make sure that there are no rips, rough edges, tears, anything sticking out. Make sure there are no obvious holes in your ET tube. That's a big no-no. If you've got holes up here, then you want to throw that tube out. You also want to examine your cuff. Make sure that it inflates properly. So I'm going to just use a cuff syringe here to insert a little bit of air. You don't want to overinflate your cuff. You can break cuffs that way. You should be getting a good amount of back pressure, and you can see here that the bulb has filled, and the bulb down here has filled. Obviously there are no holes. If there were holes, it would be deflating. So I just want to make sure that it also deflates with no issues. You want to make sure all of the mechanisms are in good working order before you insert it inside of a patient. Here we go. All right, so this is a good working ET tube, and we would be ready to go to begin placing it. Okay, all right, we're gonna go ahead and demonstrate placing a tube in the esophagus like you would if you were going to be using an esophageal stethoscope. Since we don't have that in our practice, we're just going to be using a tube as previously discussed. So the steps, we've got our patient here, his name is Max, he's intubated. Jillian's monitoring for us. We're going to go ahead and get our catheter all looped up so that it advances easily. And Jillian's going to open them up for me. And I'll go ahead, since he is intubated, our epiglottis is already down, I'm going to just go ahead and advance this catheter. If you were placing an esophageal stethoscope, you would want it to go down to about the level of the heart, so about the 5th rib. You would at that point connect the catheter to the esophageal stethoscope base, and you would be able to listen. Another thing you can do is listen to ensure that you've got gurgles for proper placement. And I've got some good sounds there. Alright, I have an all-in-one monitor here that my patient is hooked up to. It's got our SpO2, our heart rate, and our respiratory rate all in one. It's also got a graph there at the bottom so that we can see our heart rate kind of in motion. We want to make sure that it stays connected throughout the entire procedure. It's just got a sensor here that clips onto a mucous membrane, so it can go on the tongue, it can go on the lip, and this particular monitor can also go on the ear, or it can go towards the mucous membranes on the back. So for instance, on a male dog, we could put it on a prepuce. We also want to, throughout our procedure, check it by hand. Make sure that our machine is reading appropriately. You always want to make sure you keep a clock nearby and a stethoscope so that you can manually listen to that heart, listen to those lungs, make sure everything is good, and get a hand count of both your heart rate and your respiration rate. Done. All right, we're gonna go ahead and get our blood pressure reading with our Doppler. So we're gonna go ahead and place a cuff here on the patient. As you can see, I've already clipped an area to put the transducer. I'm gonna put a little bit of gel there. I've got a piece of tape here ready so that I can tape it in for the procedure. I'm going to just turn the volume up a little bit. And then I'm going to find my heart rate pulse here. You may have to move the probe around a little bit to find exactly what you're listening for. You may not be able to hear it super well in the video. Got it right there. So I'll go ahead and I'll inflate my cuff. So that we can no longer hear that heartbeat. We're going to just release the pressure slowly. Until we can hear that heartbeat again. We'll do it a few times just to make sure that we're getting an accurate reading. And then I'll go ahead and I'll tape it in just so we can continue to hear it, so that if there's any changes in that heart rate, we'll hear it as soon as it happens, but also so that we can have it stationary so that as we need to come back throughout the procedure and recheck that blood pressure, it'll be ready for us.
Hi, I'm Heather Glover. I'm the owner and the doctor here at Live Oak Veterinary Clinic of Moncks Corner, South Carolina. I am the veterinarian, and I cannot fix crazy, but I certainly can sedate it. Thanks.
All right, today we're gonna go ahead and put a catheter in Leela. She has already had some pre-meds on board, so she's a little bit out of it right now, but I'm gonna finish clipping up her leg, which is the first step. You want to make sure it's clipped all the way around. That way when you tape it, number one, you have no interference from the hair, but also so you have less grossness. Alright, and then I've got a scrub. I'm going to do a dirty scrub first. Amber, do you mind grabbing me a glove? Sure. Or a set of gloves? Do a couple dirty scrubs first since puppies are a little bit messy. And I also want to make sure I have any loose hair out the way before I start. And then I'm going to glove up. Wipe it off. And I like to discard my gloves just because they can be slippery. Can I have one more set of gloves, please? I have already prepared my extension set to go into my catheter with an injection cap on it. I keep all of the parts pieces on there until I'm actually ready to use it, so I preserve sterility. I'm putting on a fresh set of gloves, and then if I can get Miss Amber to go ahead and start holding off. With the bevel facing upwards, I'm going to go right into the vein. Alright, and then I'm going to go ahead and advance the catheter. It should advance pretty gently. And then I'm going to clamp off there so we don't have any extra blood flow. I'm then going to remove the cap from my extension set, put it on, and then we'll go ahead and tape it in and apply vet wrap. Go ahead and place an IV catheter in Diesel's saphenous vein. We've already prepped the area, so I'm going to just go ahead, bevel up. There we go, and I've got a flash here of blood. I'm going to go ahead and advance my catheter. The world's tiniest flash. I'm going to hold off there. Go ahead and put that to the side. I've got my extension set all ready to go, flushed. I'm going to go ahead and connect it. Apply a small amount of pressure there so it stays in while I tape it in. Something that can make placing your catheters easy is making sure that you always have your tape prepared beforehand. I'm going to actually slide that up just a tad. All right, we're just going to go ahead and tape it in. After it's taped in, you can put an additional piece of vet wrap around it if you prefer, just to make sure that it stays in. This is going to be a very short-term catheter, so we won't worry about that. But once you get done, you want to just flush it and ensure that it is patent. We're going to disconnect that. You should be able to feel it as you flush. Alrighty, there we go. All right, we're gonna go ahead and tape our catheter in. As you can see, we already have a little holder piece, so I'm gonna go ahead and take this piece and put it underneath first. I'm maintaining a small amount of pressure on the catheter just so it doesn't try and wiggle out. I'm gonna come all the way around the leg here. And then I have my anchor. And it's going to go right under my injection plug. And we're going to do this. I'm going to wrap it around like so. And we're going to put one more piece of tape around it. We're going to leave this down so that it's all in place. All right. I'm going to secure it with a small amount of vet wrap. We're going to put this and then also the injection port on the outside of our vet wrap for easy access. And then we're going to just wrap it back up the back side of it. You're not wanting to put this on too tightly. It's more so for an extra layer of protection. All right, and then I have a flush, so we're just going to test it out. All right, we're good. I guess I'm not getting any blood. All right, there it is. You can see a small flash back there. And in the hub. All right, done. All right, we have a sedated patient here, Brandy. We've got some monitoring on her, but I'm going to go ahead and demonstrate how to give a couple injections. First is subcutaneous. I'm just injecting saline here. The correct way we want to do that is go ahead and tent the skin, and then insert your needle. You want to pull back a little bit, make sure you're not hitting anything, and then you want to go ahead and inject that. You can let the skin go, and a lot of times afterwards you can feel a little bump there. The next thing we want to do is an intramuscular injection, also with saline. We're going to go right back here. We want to make sure we avoid any important nerves that may be running down here. So we're going to go right back here. We can tent the skin just a little bit, and then let it go. Finish inserting your needle. Pull back a little bit, make sure you're not hitting any blood supply, and then go ahead and administer your injection. In this case, you should not feel any type of bump afterwards. Okay, we're going to go ahead and give Diesel an IV injection. This is to help him come down a little bit. It's a light sedation. So we're going to go ahead. I've got Jillian holding off here, finding my vein. I'm going to go ahead and prep it with an alcohol swab. I'm going to uncap my needle with my bevel facing up. Got my flash, she let off, and now I go ahead and administer the drug. She's going to hold off as I withdraw my needle. We are going to recap and we'll be good to go. Anesthetic induction can be done by a variety of means. Today we're going to be working with a feline patient. We've given him a light pre-med, but I've got him in my induction chamber and I've got him hooked up to monitoring. I'm going to go ahead and close the lid. The way an induction chamber works is it uses inhaling anesthetics to further sedate a patient so that they are ready to go under full anesthesia, be intubated, etc. So I'm going to go ahead and close it down. It's got a seal here. I'm going to turn on my oxygen and then my isoflurane. It'll deliver it at a steady rate, so now that's what he'll be inhaling. And as I said before, it further sedates them, it induces anesthesia in them so that they can be intubated and the surgical procedure can actually begin. Induction can also be performed by injection. A lot of times people will use propofol. I discuss that later in my video. But today we're going to be using this induction chamber. Alright, we're going to go ahead and intubate our puppy dog here for our spay. This is Maggie. She's been pre-medded and sedated. We're going to go ahead and I'm going to have Mildred hold for me. I've already selected my tube. I'm going to pull out the tongue. Use my laryngoscope to pull down the epiglottis. Place my tube. Hey, Mama. You should feel it slightly going through the rings. Once you feel it in, you want to go ahead and hook it up to oxygen. We're going to go ahead and get my cuff syringe. Mildred, you can set her down. We're going to ensure that we've properly inflated our cuff. You inflate it small amounts. You should listen to see if any air is escaping. You don't want to overinflate the cuff, as that can cause additional problems that we want to avoid. It can damage the trachea. So small amounts. All right. I'm not hearing any pushback. I want to go ahead and turn on my ISO. And then if I can get Mildred to hold up her head one more time, I'm going to just take a peek with my laryngoscope and confirm visually that we are in place and everything looks good to go for our procedure. All right, we've got our sedated, intubated patient here. I'm going to go ahead and apply some eye lube to each of his eyes. I'm going to open them up, put about a 1/4 inch strip, and then blink those eyes shut, make sure it gets good coverage. We'll repeat this process on the other side as well. Done for that. Alright, I have a feline patient here. His name is Max. He's already been sedated and I've got him hooked up to monitoring. Just so we can keep an eye on him. We're getting ready to intubate him for surgery. We're going to go ahead and prep him. The first thing I want to do is palpate his bladder, see if it needs to be expressed. It feels pretty full. The way I want to do that is kind of start further up on the abdomen, working my way down with a light amount of pressure until I can isolate that bladder. I want to have my hand back here for a little bit of pressure. If he was awake, we would want somebody here to hold him and help stretch him out. I am going to go ahead and express this a little bit. I've got a tray here ready to catch. So we're going to just express that out. We want to use gentle pressure, kind of milking it out. All right, and as you can see, I've got some urine in that tray, and he'll be all ready to go to move on to our next step. Hi, today I'm going to show you how to prep a surgical site. So what we have here is a mass on this little pup dog. We're going to go ahead and just clip it around it. When you're clipping, you want to make sure you clip a wide enough area around that the surgeon can get good margins around whatever it is they're going to be operating on. In this case, we want to have good margins for removal of this mass. It's pretty pedunculated, so it should be pretty simple. The next thing to do, we're going to put some gloves on. And start scrubbing with chlorhexidine scrub. You want to use a clean hand, dirty hand technique, so whatever hand you're using to scrub never goes into the scrub bin. You want to be careful with chlorhexidine on the head because of the eyes. If it can get in the eyes, it can cause some pretty major problems down there. You're going to want to start at whatever the focal point is of your procedure and work your way out. So the cleanest spot is going to be the middle. You'll repeat this process multiple times, generally 5 to 7 times, and then you'll let the chlorhexidine scrub sit. You can also do rinses of saline wipes in between each scrub, but she's particularly dirty, so I'm going to do a few scrubs of this, and then we'll move on to the saline. And that is how you do your surgical prep. Okay, I have my patient here. We're getting ready to set him up in surgery for a neuter. He's gotten some pre-meds. We've got him on a fabric sling here. We're transferring him now from his kennel onto our surgical table here. The appropriate way to do that when you're dealing with a small animal, we've got a male cat here, you can go ahead and either have a third person come behind and lift him from the sling and place him on the table, or you can place the sling on the table. This is especially simple when working with fabric slings. I'll remove him from the sling and Mildred will remove it out from under him. I want to make sure I'm supporting his body. Now when we're doing this, we want to make sure that we're avoiding the area that we've already clipped and done a dirty prep on, which is back here. Now we'll go ahead and get him all draped up, do his final scrubs, and get our room ready. Alright, throughout a surgery, we do monitor anesthesia. We keep a written record of everything. On this record, I make sure I have my patient name, client name, what procedure we're doing. We verify those procedures prior to doing any cutting. All pertinent weight information, who your technician is, who your doctor is. You keep a monitor of what medications you've given, what doses that you've given, the route you gave them, what time you gave it to them. So I'm going to go ahead and by my monitors, I've got my SpO2 and 9, making sure I fill out every single field here. We also keep track of when our anesthesia started, what time we intubated the patient, when the surgery starts. Dr. Glover is just getting ready to begin this procedure, so I will monitor him throughout and also post-operatively in recovery. We have a section down here that we fill out as well. If there's any emergency drugs that have to be given, we make sure we record those, and any other additional comments down at the bottom. This is saved, it's scanned into his medical record, and so that we have it for all future notes. And that way, in case anything does go wrong, we're keeping a track of exactly what the trends were and exactly how well he is doing under anesthesia. When performing CPR on patients, you always want to remember your ABCs. So your airway, breathing, circulation, drugs, and ECG. First thing you want to do when a patient goes into cardiac arrest is get your airway under control. Since we're using a stuffy, as was permitted, of course I won't be able to demonstrate the use of an ET tube or a boot bag, but I will be demonstrating chest compressions. So how you want to do that, it varies depending on a large dog versus a small dog or a cat. I'll be demonstrating with my stuffy here how to do compressions on what would be a small dog or cat. You want to provide some pressure on the back just to help stabilize them. They should be laying with their feet facing towards you, and you want to be on the ribs right behind the shoulders, elbows. You want to use your hands wrapped around them to provide chest compressions. You want to do this at a pretty quick rate, 1 to 2 beats per second. Since it's such a quick rate, generally technicians will switch out every 10 to 12 seconds just to make sure that they stay fresh and that the rate doesn't suffer. Somebody will be bagging and somebody will be performing compressions, and then they'll switch. Or they'll rotate out with another person altogether. If you're in a situation where you can't do both, there's only one technician, you want to make sure that you have circulation going. That is one of your most, if not the most important part. If you don't have circulation, you don't have anything else. You can hook them up to an anesthesia machine or something like that to help provide oxygenation for them. Gloves on. So I'm going to start by removing the towel. We keep disposable towels in our practice. So I want to go ahead and open this up and pat dry, starting at the top of my hand, working my way down. Just as we did when we were scrubbing, you want to think of it as 4 different sides all the way around. I want to make sure I'm going to go up here and use this side of my making sure that it's completely dry all the way down. Now I'll go ahead and I'll throw that towel out. And I'm going to go ahead and pick up my gloves or my gown. Pull it over here. Waist, just so it's not, my gown isn't flip-flopping around. Now I'm going to go ahead and glove using the closed gloving technique. So you can see my hands are still within my surgical gown. I'm going to go ahead, pick up my glove, once it's completely covered, then you could start moving your finger out of the glove, or out of the sleeve of your gown and into the glove. Is always a difficult one for me. Remember, when you're removing your gloves, you always want to be grabbing the bottom where it's still cuffed up. Alright, we'll grab it. And now that we have one hand that's gloved, I'll go ahead and grab this one, grab my next sterile glove, and then I'll use the sterile gloves to actually pull down my sleeves. Close gloving is often a difficult procedure. For this one, since we're using the sterile part of our glove, we can stick our fingers out a little more. I'll go ahead and pull the cuff on this glove down. Here's number one, and we'll pull it down on this hand as well. All right, we're all ready to go. All right, now we have a sterile drape. We're gonna go ahead and drape our patient. I'm gonna open it up. He's been clipped and prepped. Turn it to the correct orientation and lay it gently, touching only the top. All right, we'll go ahead and I'll have the doctor approve the layout of this drape before I clamp it, just because I want to cause the least amount of trauma to our surgical area as possible. You want to make sure that everything is laid out appropriately, no edges are folded, nothing like that. All right, whenever you're setting your surgical instruments out prior to any procedure, you want to go ahead and have everything ready. Of course, I'm just doing this for demonstration. What we want to do to begin with is go ahead and get everything out, get everything ready. Each of our packs are wrapped in such a way that when they're opened, they have a table cover built in. So I like having a clean space to set them all on prior to that, and I like to set everything out. So my pack, my drape, and whatever suture that we're going to be using most likely through the procedure, I like to make sure I have that on hand as well. The scrub nurse will come out and she will open everything prior to the actual surgery beginning. But it's important to get everything laid out beforehand so you can be appropriately prepared for when that surgery is ready to begin. All right, so I'm just gonna wait until Dr. Glover indicates that she would like everything moistened, since we have a smaller surgical field. And as soon as she asks for it, we'll go ahead and moisten up the area.
Tiffany, I think this is a good time if you would, this is some momentum sitting out here, if you would just wet that for me, please. And then my gauze is there.
Okay. Would you like the gauze moistened as well?
Yes, ma'am, I'd love that, please. Maybe just a touch more. That a little close. There you go. Perfect. That's perfect. Thank you. And then we just put that on there, and we're nice and moist. Thank you.
All right. All right, I'm going to demonstrate appropriate way of passing instruments. Whenever you're passing instruments to a surgeon, you want to make sure you're doing it in the most efficient way possible. You always want to make sure that you're handing them an instrument in a way that will allow them to use it as quickly and efficiently as possible, like I said. So anytime you're passing any type of hinged instrument, you want to make sure you're passing it so that the handles are in their palms so that they can immediately orient their fingers. Some people have a preference as to whether the boxes should be left open or closed. A lot of times open is going to be the quicker option. When you're passing thumb forceps, or I've got some thumb forceps here, you want to make sure that you're passing them and putting the handle not all the way down in their hand. You don't want to pass it and have them palm it like this, because that's going to be useless for them. You want to pass it in such a way that they can grab it about halfway where they would naturally grab the instrument to actually use it. When you're passing something sharp, for instance a scalpel, you want to make sure that you're passing it with the scalpel blade away from them so that it won't damage them when they go to grab the instrument, but also so that it won't damage you when you grab the instrument. So I'm going to reorient my grasp on this. You want to do it something like this. So you see here, the way I'm holding it, I have a firm grip on it, but I have the sharp side of the blade facing down, and then I've got the end of it opened so that if I wanted to pass it to somebody, they could immediately grab it, get a good grasp on it, and we would have safely then transferred that instrument over to their hand in a useful and quick manner. I'm going to demonstrate the appropriate way to put a scalpel blade on a handle. So what I've done is I've got my handle here and I've got a blade. I'm using another tool here. You always want to use, whether it's a pair of hemostats, some kind of clamp, something to hold the blade for you while you put it on the scalpel blade. What you want to do, you'll see there's a small groove in the handle. You want to just gently insert the scalpel into the groove. As you slide it back towards your hand here, you'll hear it click into the handle. You can apply a little bit of pressure just to pull it upwards, just to make sure that it's firmly seated before you hand it to the veterinarian or place it back in the case to be used later for surgery. The space immediately above and around a sterile pack is considered the sterile field. Once you scrub in, and glove and gown, you are considered sterile from 2 inches above the elbow to the tips of your gloves. Now, the cuffs of your gown are not considered sterile, and that's because perspiration can breach those areas. That's why it's covered by your glove. Now, your job as a sterile technician, depending on if you're serving as the scrub nurse or the circulating nurse, overall your job is to ensure that the veterinarian is able to fulfill their job in the most efficient, successful way possible. So you want to have that surgery prepared for them, make sure you have all the appropriate equipment, make sure the patient is prepared and ready to go for them before they enter that room and actually begin the procedure. You also want to make sure that you're appropriately monitoring the patient, assisting the veterinarian either by handing them tools or making sure that they have the appropriate packs open and instruments available to them. Now, in the event that an instrument is dropped or somebody breaches the sterile field, now, of course, once the sterile field is breached by somebody who is not sterile, it is no longer considered sterile. And, for example, if somebody who is non-sterile touches the gown, the sterile part of the gown, then that person would need to completely remove their gown and their gloves. They would want to stay aseptic, maintaining aseptic technique, and in the event that they did maintain aseptic technique the entire time, they would be okay to go ahead and re-gown and re-glove and scrub back into surgery. In the event that they dropped an instrument, then that instrument, if it's the only one in the practice, then it should be immediately flash sterilized, or it should be replaced ideally with an instrument, the same type of instrument, new but sterile, so that it has been completely processed so that we know it's free of any possible germs or pathogens. Hi, I'm Tiffany Campbell, and we're doing a routine canine neuter today. So if you want to show them Dr. Kahi taking some testicles away. Hello, Tiffany Campbell here. We are doing a canine spay, open doggy with Dr. Kahi. Yeah. Alright, Tiffany Campbell here. We are working on a routine feline neuter here. We've got our kitty cat. I am practicing monitoring my anesthesia. And so far everything is going super well. Should be a very routine surgery. Hi, I'm Tiffany Campbell, and today we are doing a routine spay on a kitty cat. Everything is going super well. No more ovaries for this one. I'm going to demonstrate the appropriate way to wrap an instrument pack. So we want to start, we've got our drape here. It's a disposable drape, so I go ahead and cut it out. Sometimes you can get them pre-cut. But generally every practice will have their own way of doing it. In our practice, we order it by the roll and cut off a predetermined amount that's set forth in our technician manual that tells us exactly how much to cut for each different type of pack. So I've got my base here that we use. I'm going to go ahead and organize my instruments that have been scrubbed. Make sure all of our locks are open. I'm organizing them in size from largest to smallest. This is just a basic laceration pack. So what we've got in here are just a couple different types of scissors and forceps, needle drivers, towel clamps, scalpel handle, some Addison Browns, and some rat tooth. Once we've got it all organized by size, we're going to go ahead and once again just double check those locks, make sure everything is open. I'm going to take the largest instrument, put it through the handle like so, and lay it flat, Some clinics will have instrument boxes that they place them in, and those may have dividers that tell you exactly where to set your instruments. Since this is just a minor pack for us, we don't use an instrument box. So I've got that laid out. I'm going to go ahead and place my Addison Browns and my rat tooth right under there, as well as my blade handle. I'm going to go ahead and put our gauze out. We already counted it out. We do 5 and 5, so a total of 10 gauzes. I'm going to put my towel clamps on top here. Some places will also include a disposable drape on top. We use reusable drapes in our practice. The next thing you want to ensure is inside of your pack is a sterilizer indicator strip. That is how, when we open the pack, we're going to just confirm that our pack is sterile. So we're going to go ahead and put that in here. And we're going to go ahead and start folding this. So we're going to take the first side, fold it up, and accordion it down. We're going to grab our next corner, fold it in just like you're wrapping a present, and bring it over top. Same thing, we're going to do that on this side, bring it across, and then we're going to flip it back around to us. And on the inside, we're going to fold that edge down just like you're wrapping a present. Fold the top down. You're going to accordion it up, that way whenever the surgeon goes to open it sterilely, they can just pull and the whole pack will open. If you use an instrument tray, generally you only have to use one wrap of drape. Since we're not using a tray, we're going to go ahead and double wrap. And so we do it in the opposite direction. So since this was the top piece over here, it's going to be the bottom piece on our second layer. So we're going to just wrap it exactly the same way. Fold the bottom corner up, accordion it down. Fold our sides over. As you can see, this creates a nice little fold right here. When I fold this side down and this side down, just like I'm wrapping a present, I'm going to pull this down and fold the top piece under that little lip that I've just made. That helps ensure that it stays closed. It should be neat, as wrinkle-free as possible is what I like to follow. I'm going to go ahead and use my indicator tape to wrap the pack, making sure that it stays sealed until the time that we are ready to use it. Alright, now that I've got it taped, I'm going to go ahead and use my Sharpie to label it. I'll write laceration pack. Today's date, because today is the day it will also be sterilized. And then I'll initial it so that they know who exactly it was prepared the pack. All right, it's all labeled, all ready to go. I'll go ahead and put it in my autoclave and we'll move on to the next step. All right, I'm going to demonstrate the appropriate way to fold a surgical gown to wrap it. So with the back facing you, you want to fold it together like so, matching those seams. Pull it out by the underarms to make sure everything's straight. Follow that hem down with your hand to make sure that everything is aligned appropriately. We're going to lay it out here, make sure all of our strings that need to be tucked in are tucked in. We're going to fold it in half once more. And then we're going to do an accordion fold all the way up to the top. And then the top, we're going to make sure that our strings are pulled out so that we can, whenever you open the gown, it's available. So I'm going to start with wrapping it, I'm using a disposable drape. I want to make sure that I include a sterilization strip indicator. So I'm going to start by printing the bottom up the same way that we wrap an instrument pack. It can be a little more difficult when you're working with fabric. So you might have to, kind of hold it down, make sure it doesn't just fly off. We're going to pull the sides across like so. I've got a little excess, so I'll fold it that way. Folding the edges down like we're wrapping a present here. And then we're going to bring it over the top and tuck it in to our other layers. We're going to do our second layer exactly the same. Fold that top down. I like to make my outer layer a little more snug usually. Pull that top down, make a nice little point, come back and tuck it. All right, now we're going to go ahead and tear off a piece of tape. To write on there what it is. It's a small surgical gown. Today's date. And then my initials. Alrighty, we are all ready to go to put it in the sterilizer. Alright, I'm going to give a brief overview of using an autoclave. So basically an autoclave is a method of sterilization that uses heat and pressure to sterilize instruments. Basically, the simple steps for using it are to appropriately pack the instrument or appropriately pack the machine, at which point some machines fill up automatically. Some of them have to have a step where you fill the chamber. Then you would close the door, use the handle to tighten it up to its maximum tightness, turn it to sterilize, make sure you have it on the appropriate temperature, and then turn your timer on. At which point, some of them have an automatic drying cycle. Some of them, like this one in particular, you have to manually turn it to the dry cycle. So the way that we would pack an autoclave, I've got a pack that we wrapped earlier. I'm going to go ahead and place it in. So you see we've got this tray so that your pack is not touching the bottom of the autoclave. You also don't necessarily want it to be touching the sides or the roof. So we're just going to slide this right in and it fits perfectly so that it's not touching the side. Our rack helps us to ensure that whatever we put in there isn't touching the sides of the autoclave. At which point we're going to go ahead and prepare to run it. So I'm going to turn it to our fill setting. We watch it, it's got a fill line in here. Once it fills to there, we'll go ahead and turn the water off. We'll close the door. You also want to ensure that your pack is in far enough, that way it's not touching your door. So we'll place it in and tighten the door. As tight as we can get it, and then we've got it turned here now to sterilize. We want to make sure that it's at the appropriate heat setting, which is 250 degrees Fahrenheit or 121 degrees Celsius. The minimum time you want to autoclave packs for would be for 13 minutes at this temperature. It'll get up to about 300 psi pressure. And that's what's generally considered minimum safe temperature and time. Of course, you can go higher up, or if you were doing, for instance, like a flash sterilization of unwrapped packs, you could do it for a shorter amount of time. But for what we've got here, wrapped packs, that's what we're going to get set up for. So I'm going to go ahead And now that we've got it on the appropriate heat, I'm going to just turn that timer. I'm actually going to go up to 15 just to be on the safe side. Now, another important thing to remember about autoclaves is that they do require a good bit of upkeep. Now, the way that you upkeep this particular machine is, number one, wiping out the chamber. You want to make sure that you use an actual chamber cleaner. They make a wide variety. Some spray inside, some go into the reservoir, and you run a cleaning cycle. It helps loosen up any buildup that may be in there, and then you wipe it out later. You also want to make sure that you're using a reservoir cleaner to make sure that that stays kind of as germ-free as possible. Another thing you want to make sure you do is always check your pressure valves. Make sure that your steam relief valve is in good working order. Those are kind of more weekly or monthly maintenance tasks, but you want to make sure that they do that so that in the event that there was a problem with your autoclave, that too much pressure didn't build up, because then essentially we would have a bomb sitting in the clinic. Obviously, we don't want that, so it's important to make sure that you properly upkeep your autoclave. Another thing to note is that you do have space around it, so nothing's immediately touching it, so that since it does get hot, we want to make sure that we're protecting all of the things around it. Alright, I'm going to go over how you determine whether or not a pack is sterile. I will be opening this in an unsterile way, so afterwards, after this video, it will have to be reprocessed, but this is one of the packs that we wrapped earlier. So number one, my first indicator is that our tape has changed color, so we know that at least externally it was exposed to high enough temperatures to make that change. So we're going to open up this pack. If I were opening it in a sterile fashion, I would pull this out, open these sides up, and then from here I could pass it to a surgeon, or if I were being the sterile technician, I would go ahead and open it up the rest of the way, since we are going to reprocess this pack after the video. It'll be okay. So the next thing I want to look for, of course, is we always look at our sterilization strip indicators. It changes color whenever it's exposed to high enough temperatures, and so it says right here, stripe turns dark with processing. It's pretty simple. As long as it's dark the same color as the test strip over here, then you know that your pack has been appropriately processed and is sterile. As I said, this pack will now be reprocessed since I did open it and touch all the instruments and I'm not sterile, but that would be how you would determine whether or not a pack was sterile. All right, we're gonna go ahead and do a staple removal on Layla here. She had her leg amputated. Dr. Glover has already done her exam, made sure everything is good to go. These staples can come out. We have our staple remover here. What you want to do is just gingerly go under the staple. When these are put in, they're put in loosely enough that they can come out pretty easily. Apply a little bit of gentle pressure, and the staple just comes out just like that. You want to examine it, make sure all of the pieces came out and nothing broke off and remains in the dog, and we'll just keep doing that all the way up the incision. She'll be good to go.